If you were born in Hawaii, you can expect to live to 80. If you were born in West Virginia, statistically, you won't make it to 73. Same country, same year. Almost 8 fewer years of life, just based on which state you were born in. That's not a guess. That's the newest CDC data. And where your state ranks might surprise you.
Here's the headline number. American life expectancy just hit a record high, 79 years, according to the CDC's newest report, released this January. Deaths dropped. The numbers are recovering from the pandemic. On paper, that's good news. But that 79 is an average, and averages hide the real story. Because when you break it down state by state, you're not looking at one country's life expectancy. You're looking at 50 completely different ones. By the end of this video, you'll know exactly where your state ranks and the honest reasons why. At the top, Hawaii, 80 years. Right behind it, a cluster of northeastern states, Connecticut, Massachusetts, New York, New Jersey, all pushing past 79. At the bottom, West Virginia, 72.2 years. Mississippi, Louisiana, Alabama, Kentucky, Arkansas, Oklahoma, Tennessee, almost the entire bottom 10 sits in one region, the South and Appalachia. That's not random. That's a 7.8-year gap between the best and worst states in America, inside one country, one government, one healthcare system, on paper. Let's talk about why. Hawaii's advantage isn't one thing. It's 4 things stacking on top of each other. 1, the lowest obesity rate in the country. 2, one of the lowest smoking rates nationally. 3, near universal health coverage, one of the lowest uninsured rates in America. 4, tight-knit communities, and strong social connection is one of the most consistent predictors of a long life in public health research. Add a traditional diet, lower in red meat and higher in fish and vegetables, and a climate that makes outdoor activity possible year-round, and you get a state that's outliving the rest of the country by years, not months. Now flip it. In the states at the bottom, the same 4 factors work in reverse. Higher obesity rates, higher smoking rates, less access to preventative health care, especially in rural counties, and lower rates of Medicaid expansion, which limits care for lower-income residents before small problems become fatal ones. Researchers have actually tracked elevated heart disease death rates in this exact region, from Arkansas through the Carolinas, going back to the 1960s. This isn't new. It's decades of overlapping disadvantage compounding. And there's a layer most people don't expect. In every single state, women outlive men. In Utah, that gap is just 3.6 years. In New Mexico, it stretches to almost 7. Even within the state-by-state story, there's a second story hiding underneath. So, what do you actually do with this? You can't just move to Hawaii. Believe me, I checked the cost of living. But the 4 factors driving this gap, smoking, obesity, healthcare access, and social connection, aren't just state-level statistics. They're individual choices, too. States with better outcomes didn't get there by accident. They got there because their systems made the healthy choice, the easy choice. If you're in a lower-ranked state, that doesn't decide your outcome. It just means the default settings around you are working against you a little harder. Worth knowing. Worth planning around. So, Hawaii at the top, West Virginia at the bottom, a 7.8-year gap between them, and the real drivers are smoking, weight, healthcare access, and community. Not random, not fate, just data. Every week, I'm breaking down one story like this, the real numbers behind health, money, and how they connect, state by state. If you want to know how your state stacks up next, subscribe. And drop your state in the comments. I'll tell you exactly where it ranks.